Hey everyone, today we're talking about a recent shakeup at the Department of Health and Human Services and the Centers for Medicare and Medicaid Services, specifically the repeal of a rule that incentivized hospitals to report their staff's COVID-19 vaccination rates through financial reimbursements. This policy was originally put in place during the Biden administration, and its removal under the current leadership, including HHS Secretary Robert F. Kennedy Jr., has sparked a lot of debate. I'll break down what the rule was, the arguments for why it was created in the first place, and the counterarguments that ultimately led to its elimination. Let's get right into it. First off, what exactly was this rule? It was part of the CMS's payment systems for hospitals participating in Medicare and Medicaid. Hospitals had to report the percentage of their healthcare personnel who were vaccinated against COVID-19 to the CDC's National Healthcare Safety Network. In return, they could get bonuses or avoid penalties in their reimbursements. This data was made public, aiming to boost transparency and accountability in healthcare settings. The rule built on earlier mandates from 2021 to 2023, which were all about ramping up vaccinations during the height of the pandemic. Now, let's look at arguments in favor of why this rule was made. Proponents, including public health experts and officials at the time, saw it as a critical tool for protecting patients and staff. One key point was infection control. Healthcare workers are on the front lines, and higher vaccination rates could reduce the spread of COVID-19 in hospitals, at least in theory, where vulnerable people like the elderly or immunocompromised are treated. By tying it to reimbursements, it could encourage hospitals to prioritize vaccinations, much like how we incentivize other quality measures, such as reducing hospital-acquired infections. Supporters argued it promoted transparency, letting patients make informed choices about where to get care based on a hospital's vaccination data. During a global health crisis, this was seen as a way to build trust in the system and ensure resources went to facilities that were taking public health seriously. Essentially, it was framed as a data-driven approach to save lives and prevent outbreaks in medical environments. But as with any policy, there were strong counterarguments, and these are what fueled its recent removal. Critics, including the current administration and figures like RFK Jr., called the rule coercive and a violation of personal medical freedom. They argued that linking financial incentives to vaccination reporting pressured hospitals and doctors into pushing vaccines without fully respecting informed consent, meaning healthcare workers might feel forced to get vaccinated or face indirect penalties through their employers' reimbursements. Another big point was government overreach. Why should federal dollars dictate personal health choices, especially post-pandemic when COVID-19 is less of an emergency? Opponents said it shifted focus away from patient-centered care, turning medicine into a checkbox exercise driven by bonuses rather than individual needs. There were also concerns about administrative burdens. Hospitals had to spend time and resources on reporting, which could distract from actual patient care. Finally, some pointed to evolving science and vaccine hesitancy, arguing that mandates or incentives like this erode trust in institutions and ignore potential side effects or alternative approaches to health. In the end, these views aligned with broader reforms under the Make America Healthy Again initiative, emphasizing autonomy over mandates. So there you have it, a policy born out of a crisis response, but scrapped in favor of individual freedoms. What do you think? Was the repeal a step forward for personal choice or a setback for public health? Drop your thoughts in the comments below, like if you found it helpful, and subscribe for more breakdowns. Thanks for tuning in.